What qualities do you think future health leaders have to restore faith, trust, and integrity in our organisation? I mean, what do you think needs to happen?
Well, I think, Professor Bhattacharya is probably a very good example of what we need to have in our health policy, our health bureaucrats, our health leaders. Now, I mean, he has basically earned his stripes, as it were, the hard way. And by speaking up, I remember him saying, if I can't, as a Stanford tenured professor, speak up, then who can? He saw it as his duty, but it wasn't without cost. He was persecuted. He was taken through the mill by his own university, I believe, and just suffered some terrible, attacks on his credibility. And to see him rise to be head of the NIH now, it really is probably one of the most encouraging things that I have seen in the last 5 years. And what do we need from our health leaders? We need integrity. We need honesty. We need people who are actually prepared to say the hard thing, to ask the hard question. And I know that in his speech to the Senate when he was having, what do they call the session where
Yeah,
they
yeah.
basically grill them,
Yes,
and he talked about, freedom of speech and freedom of scientific discourse. We need to be able to do that. And that was what suffered tremendously during that period. And it was Scott Atlas as well, who I spoke with. And, he's actually helped to set up a organisation called the Global Liberty Institute. And they are training up, young leaders. Many of them are already sort of blooming leaders, but the younger generation to be able to, work in these spaces. And one of the questions that they ask them is, what have you done to show courage? So we need courageous leaders. We need the people who are actually prepared to sacrifice their careers, their reputation to do what's right.
yeah,
And it alarms me even to have to say that, because it sounds so poetic and like it's out of a movie, but it literally is as simple as that. We need people who are not scared to risk everything to say what's right and to do what's right. And